Right, we're going to go ahead and get started. Welcome everyone to our free nutrition, health and wellness webinar with Ketie Dodd. My name is Whitney Pancook. I am the marketing and communications manager with Prestige Care for our skilled nursing and rehabilitation centers. One of the things I love the most about Prestige is that all of our center staff is committed to helping patients that come from a number of different health situations, and we're able to serve them in a number of ways with the goal of ultimately transitioning them to successfully from hospital to home. We want to really improve the health and wellness of all of our residents and really help them return to their independent and active lifestyles as quickly as possible. We are so excited to have Ketie here with us. We hope as you tune in today, learning about our post-acute care nutrition and wellness, that you will learn some valuable information and be offered some education and resources through what Ketie has to share with you. We hope you can come away with this with new perspective and answers to what you and your loved one are going through during and after post-acute care. Just some background on Prestige Care. We've been around for about 37 years, and at our skilled nursing and rehabilitation centers, we care for residents of all different health backgrounds and situations, whether they are recovering from a planned joint surgery, need care after suffering a fall, or have recently experienced a serious health issue. We are located around the West Coast, and we also offer independent living, assisted living, and memory care. Our goal is not only for patients to recover, but we also want to prevent future complications. And with resources and education, such as these webinars, we are able to do that. We are so grateful to have Ketie Dodd here with us to talk about all those different areas that meet the nutrition and wellness needs of all of our residents, older adults, and everyone in our local community. Ketie is a registered dietitian, and she is a board certified specialist in gerontological nutrition. After spending about 13 years working as a home care dietitian for the VA, she recognized that there is a need in the community to spread awareness of how nutrition and wellness really can make an impact in a person's recovery after hospitalization. She is located in Medford, Oregon. She has extensive experience as a nutrition consultant and a mentor, and has presented in a number of groups and conferences. She's also the owner of Ketie Dodd Nutrition, founder of the Geriatric Dietitian blog and High Calorie Recipes food blog, as well as the host of the Dietitian Side Hustle podcast. We hope this information that she shares with you all today will support you and your loved one as you're navigating through your recovery journey. The chat and the Q&A are open for questions, so feel free to ask any questions that you have about the presentation or for Ketie, and we will address those at the end of the webinar. Thank you guys all for being here today, and we hope you enjoy this presentation. Ketie, I'm going to hand it off to you and let you take it from here.
Awesome. Well, thank you so much for that introduction, Whitney. I am so excited to be here today to talk to you all about nutrition and wellness, an area that I'm so passionate about. So Whitney shared a little bit of my background, but I just want to take a minute to explain that alphabet soup that's after my name. I've got more initials after my name than in my name, and people always ask me, what does that mean, Ketie? So just to break it down for you, the MS just means I have a Master of Science in Food and Nutrition. The RDN means I am a registered dietitian nutritionist. I completed a certain number of hours for a dietetic internship and passed an exam and maintained my continuing education credits. The CSG means that I am certified in gerontological nutrition, meaning nutrition specifically for older adults. The LD means that I'm licensed in the state of Oregon. And the FAND is the Fellow of the Academy of Nutrition and Dietetics. And I always tell people that just means I volunteer a lot. So I am the owner of the Geriatric Dietitian website. And as Whitney mentioned, I was working for the VA doing home care for, 13 years. And I really loved working for the VA. And one of the things that I loved about it is that I was able to see every veteran enrolled in our home care programs. So I did not have to wait till they screened positive for malnutrition or were identified as there's something wrong. Now let's help. I was able to work with them early on. So that way we could implement nutrition strategies to help them really have the best quality of life possible. So in working in that structure and seeing the value and the benefit of giving this a good nutrition information to the public, it just made me realize I need to get the word out to more people. So through my blog, I'm able to reach over 100,000 people every single month and spread this information that I'm so passionate about. And one of those areas we're going to be talking about today. So I also live in Southern Oregon. For anyone who's listening, might be in the Medford area. I have been to some of the prestige facilities down here in Southern Oregon, and I'm just so excited to be here today for this webinar. So I know that Prestige Care understands that if you or your loved one have been admitted to a post-care center, it's important to consider your nutrition and wellness to ensure optimal recovery. So they asked me to host this webinar, and I am so grateful for that because there are so many benefits when it comes to maintaining a healthy lifestyle, both during rehabilitation and post-discharge, and learning how we can manage our health complications to, prevent future things in the future from happening. So whether you are continuing your recovery at a skilled nursing center or are interested in learning how you or a loved one can maintain a healthy lifestyle, I've got some good nutrition tips and education for you. So my hope, by the time we're done with this webinar, that you are able to understand changes in nutrition and health with aging, the benefits of maintaining a healthy lifestyle during rehabilitation and post-discharge, and then how you can manage your own health and prevent future complications. So I know it's going to be a quick hour, and afterwards the question is, what are my biggest takeaways? And these are kind of my biggest takeaways that I hope that you understand when we leave. So on the agenda for today, this webinar is going to be a little different. Yes, we're going to talk about nutrition, but we're also going to talk about the science. I think it's really important to lay that foundation of why. Why am I making certain nutrition recommendations? And so we are going to dig into changes in nutrition and health with aging. We're going to dive into the physiology of aging. We're going to look at health changes, nutrition needs, and other issues. Then we'll talk about how to maintain that healthy lifestyle, both during rehab and post-rehab. We're going to dive into some specific nutrition stuff, particularly on protein. We'll wrap things up, and we will have plenty of time at the end for the questions that you may have for me. So as Whitney shared, go ahead and put those questions in the chat as you are thinking of them throughout today's presentation, but I will answer your questions at the end. So let's talk about changes in nutrition needs. So throughout the life, our nutrition needs change. We think of every stage of life, from a baby being born to a toddler, to a child, a teenager, a young adult, a aging adult, someone who is in retirement, and someone who is close to end of life. Our nutrition needs at every stage of life change. And while we notice when we look in the mirror, what we see changes, right? From, again, the baby to the young adult to the older adult, the way we look on the outside changes, but also what's going on inside our bodies is also changing. So I'm going to be talking about the physiology of aging and the nutrition changes that come with aging. And I do want to emphasize that the information we're covering is really general information. So I do want to acknowledge that everyone's situation is different. Maybe your genetics, maybe the medical conditions you have, and also with your age. When we talk about older adults, it's generally anyone ages 65 and older. But we know age 65 can vary greatly from age 95. So keep in mind as I'm talking, this is general information for the healthy aging adult. And with your own individual situations, I always encourage you to talk to your own healthcare team, talk to a dietitian for specific individualized information for you. So let's dive in and talk about the physiology of aging. Now, this slide is exactly what a slide should not be. There's too many words. There's not enough white space. There's lots of concepts. And again, it's pretty much everything a slide shouldn't be. It's way too busy. But I like the slide for the reason that it paints a really good picture of the physiology of aging. There's a lot going on. So what is physiology? Physiology is simply a branch of science that deals with how living things work or how our body works. So what we're looking at here is how functions in our body change as we age. Now, these are all normal changes, again, normal healthy changes, but everyone may vary, that you might not experience all of these. Even if you experience one, you might have a very mild degree versus someone else who has a very strong degree of these changes. But in general, in aging adults, these are the changes that we see in the body. So within the GI tract is essentially the route that food takes from the minute it enters our mouth to the minute it exits. And we have a lot going on in the GI tract. First off, we have xerostomia, which is dry mouth. And we see poor dentition, which is problems with the teeth and therefore problems chewing or eating our food. Altered taste and smell, it's typically altered or minimized, although some people do experience a complete loss of taste. Decreased esophageal reflexes, which means problems with swallowing. Decreased glucose tolerance and insulin and beta cell production, which in a nutshell means we tend to see more diabetes as someone ages. Decreased metabolic capacity of the liver, decreased hepatic drug clearance. This basically means that it impacts how medications are used in the body. We also see increased fecal incontinence, which means more accidents. And that's just what's going on within the GI tract. Looking at the other side of what's going on in the body, we also see decreased skin elasticity. This means that there's an increased risk for skin breakdown, skin tears, pressure injuries, which are also known as bed sores. We see more age-related macular degeneration and hearing loss, which just means difficulty seeing or difficulty hearing, thickening of the heart, alterations in heart sizes, which can lead to a variety of things that can impact the health of the heart, decreased breathing capacity, decreased GFR and renal blood flow, which is really just how the kidneys work, decreased sensory perceptions, decreased cognition and memory loss, and also loss of lean body mass, which is muscle. We're going to talk a lot about muscle through today's presentation. We also see degeneration of the joints and decalcification of the bone, which can increase risk of fractures and potential bone problems like osteoporosis. So, there is a lot going on, and thanks for hanging in there with me as I gave this high level view of the physiology of aging. But my take home point is that what's going on in the body as we age is complex. There's a lot going on. And because of that, our nutrition needs are changing. So we're going to break down some of these specific things and dig into them a little bit deeper, because again, this is going to lay the foundation to where when we talk about what the nutrition needs are for the aging adult, it's going to make a little bit more sense. Okay. So we're going to take a look at some of the biological changes we see in aging, and we'll talk about why they're important and how this impacts nutrition status. So first off, let's talk about dry mouth. So dry mouth refers to a lack of saliva in the mouth. Saliva has so many important functions that most of us never even think about. Saliva lubricates our mouth, it keeps it clean, it aids in chewing and swallowing, it helps us to taste food, and even has a role in speaking. Without saliva, food and bacteria can hang out in the teeth, hang out on the gums, and increase our risk for dental caries or cavities and gum disease. So to put it simply, the less saliva we have, the more dental problems we tend to have. And we know that dental care is also really expensive, and too many people forego dental care due to limited finances. It's pretty darn expensive to take care of our teeth, and not a lot of people have dental insurance. And another thing to keep in mind is that also, if you're on a lot of medications, that could also be a culprit for dry mouth. So many medications list dry mouth as a side effect. And we also know that as we age, we tend to be on more medications. But I will say that research is suggesting that older adults may have less saliva regardless of medication. So that might not be something to worry about too much. So in a nutshell, we do see more dry mouth in aging adults than any other age group. And dry mouth is a major issue when it comes to managing oral health. And oral health is the first route of nutrition. If we can't eat our food, that is a problem. So all of these things have impact on the nutrition status of older adults, from having dry mouth to dental problems. And I always talk about nutrition and oral and mouth care, because it's really important that we take care of our mouth so that way we could eat the foods and get the good nutrition our bodies need. So next, we talked briefly about altered taste and smell. I mentioned it's typically not a complete loss, but sometimes it could feel like it if you are experiencing altered taste. So sometimes people wonder, why are you using a lot of salt? And they don't always jump or ask the reason why. They just jump to the recommendation of, oh, you're eating too much salt, you need to stop eating salt. But I think there's an important question we need to ask when people are using a lot of salt, and the question is why. For a lot of people, you're using more salt because food doesn't taste good. And if food doesn't taste good, you're not going to eat. If you don't eat, you're not going to get all the nutrition benefits we're going to talk about later. So I always emphasize that flavor matters. There are lots of ways that we can make our food taste delicious without salt. And also for some people, yes, you need to cut back on salt, but for a lot of people, having some extra salt is okay, because it's going to mean that you're going to eat your meals and prevent some of the complications we're going to talk about later. So when it comes to food, flavor does matter. So the final biological changes include just those changes we see with our organs working differently. The function is typically diminished, meaning they're just not working at their top capacity anymore. And our bodies are like anything else. Over time, they just might not be working as well as they used to. And that is normal. This is the pathophysiology of aging. So the organs that we typically see working differently with aging are the heart, the liver, the lungs, the pancreas, the things we talked about on the previous slide. But all of those things do impact how our bodies work, how nutrients are utilized, and in turn, our nutrition status. So let's look at some of those physical changes we see with aging. First, we see that decreased skin elasticity. So skin is more frail, it's more thin, and it's more prone to injury. This is a big problem if you have a fall, right? Or even if you just stumble or run into something. Our skin doesn't provide as much protection as it once did, which means that skin tears can easily happen. And when we have issues with, tears in our skin, whether or not it's from falls or an injury or sitting in a chair too long and getting those pressure injuries under those bony prominent points of our skin, whether or not the buttocks or the heels, it can cause a lot of problems. And we're going to be talking about the importance of getting good nutrition. And what I mean by that is eating enough calories later on in the presentation. And if you have something like an open wound, your body's going to be working really hard on the inside to heal that wound, which means you're going to be burning more calories, which means you need to eat more food, get more nutrition. So that's one thing to keep in mind, is that with aging comes decreased skin elasticity and more risk for skin injuries. So next, let's talk about muscle loss. This is known as sarcopenia. We're going to talk about this later. So I'm not going to spend too much time on it now, but we do know that we need muscle for everything. I like to give the example of, think about when you got up this morning. What was the first thing you did? For most of us, we pulled back the covers, we got out of bed, maybe you went and brushed your teeth, or you prepared some breakfast. But whatever you did, there's something that you used, a lot of things you used, but one thing in particular you used that you probably didn't think about, and that was your muscles. You used your muscles to pull back that cover, get out of bed, walk, brush your teeth, make the food. And if we don't have muscle, we can't do those things. So muscle is going to be the key point of my presentation today. Muscle helps us to maintain our independence, to not have to rely on others to help us for things. So with aging does come sarcopenia. This is a natural decline in muscle mass with age. And we know that when we lose our muscle, we lose our independence. So loss of muscle affects nutrition status and overall health in a lot of negative ways. So protecting muscle is so, so important. So I mentioned how we see weaker bones, and this is typically from decalcification of the bone, which is a normal part of aging. So when it comes to keeping our bones healthy, calcium provides the structure in our bones. And if we lose it, our bones become weaker, which means if we fall, we are at an increased chance of, fracture, breaking our bones, and different injuries. So this ties into fall risk. We see increases in fall risk with aging due to a lot of things. It could be because of that muscle loss, weakness, frailty, medications, all kinds of things. But we do know that a fall risk is a big deal because it could lead to a lot of injuries and lead to hospitalization. So next, looking at some functional changes with aging. First off, we have mobility. This is our ability to move freely and easily. And this ties back into the muscle. We need muscle to be able to do this, right? So next, weakness. This kind of goes hand in hand with mobility, but when someone is more frail and weak, it could be harder to stand for a long time. And when you're at home independently, that means it could be harder to go shopping, to bring that food back inside that you made or that you bought with you, to cook those meals, to prepare those meals. So with many of those who are weak, it could be really hard to even eat independently, to grasp a utensil, to bring that utensil from plate to mouth. So weakness can absolutely impact our ability to get good nutrition in our body because it's hard to make food or even hard to eat it. Another functional change we see is poor dentition. And we mentioned that before when we were talking about the oral health, but this is really talking about loss of teeth. And one thing I do want to emphasize that losing all of your teeth is not a normal part of healthy aging. Sometimes there's a misconception as, oh, when I get older, I get dentures, but that is not true. So I always do talk to people about making sure that we brush and floss and keep our teeth good, because we know that natural teeth has a better bite force than dentures, and even can improve things with even with taste and eating your food. So The last piece I wanted to talk about was those decreases in cognition that we mentioned, and that just really changes how the way the brain works and thinks, also decreases in memory. These changes can impact dietary intake in a lot of ways, where someone might forget to eat, or maybe they thought, oh, I already ate, or they might not have the same hunger cues as they used to have, which could lead to them going a long time without eating. So when we don't eat, we don't get that good nutrition our bodies need and the things that we need to stay healthy. So I know we spent a lot of time talking about the physiology of aging and all the changes we see, but I hope that this helps paint that picture of there's a lot of changes going on in the body and that can impact nutrition. So I'd like to take a minute to give a plug for healthy aging and why it's so important that we eat right, that we're physically active, that we take care of our bodies as we age to minimize some of the effects of normal aging. So how you live does affect how you age. There are certainly things we can't control, like genetics. Sometimes genetics will throw you a curveball. You're doing everything right, but you still, get that disease, get that illness. So genetics is a curveball, but there's a lot of things that we could do to stay healthy now as we continue to age and keep you healthy and functional for the duration of your life. So nutrition and hydration are huge. That's what I'm going to focus on today. So eating a healthy, balanced diet, staying well hydrated, but also staying physically active. If you aren't physically active, I would encourage you to find something physical that you enjoy doing. You don't have to run or hit up the gym. It could be something as simple as going on a walk with a friend, gardening, lifting some light weights while watching TV. It doesn't have to be complicated. It just has to be something you like to do, because we're going to talk about this, but exercise is really important to preserve your muscle and to optimize your health. Now, sleep habits matter. Sleep deprivation can have a negative effect on the way your body works. Taking care of your mental health is so important. Talking to someone when you're having a hard time and knowing that it's okay, because we all have a hard time sometimes. Poor mental health can also in turn impede your ability to get good nutrition and to stay physically active. And finally, lifestyle choices matter, like smoking cessation, drinking less, and we just know that all of these things have a big impact on health. So I would also like to say that it's never too late to make changes to our health. And I don't care how old you are or where you are at with all these things, it's never too late to start or make a change. And these healthy changes could optimize how healthy you are as you age. So next, let's talk about some of the key nutrients for older adults. Now, the 6 nutrients on this slide: protein, fiber, vitamin B12, vitamin B6, calcium, and vitamin D. These are all nutrients that have a changing need as we age. So these are all nutrients that older adults typically need more of, and I'm going to explain this to you guys, okay? So I will say that for the last 3 nutrients, the vitamin B6, calcium, and vitamin D, there's a higher RDA. RDA means the recommended dietary allowance. This is how much of a nutrient a person should have according to the Institute of Medicine. There's all these guidelines out there on how much of every nutrient we should have based on our age and our gender. So for vitamin B6, calcium, and vitamin D, the RDA is higher for older adults than it is for younger adults, which means that older adults need more of these nutrients. For protein, the RDA for older adults is the same for younger adults, but emerging science is telling us that older adults actually need more resistance exercise and protein in order to promote muscle health, and we'll talk about that later. And I will say the exception to that rule is with kidney disease. But again, if you have specific medical conditions, talk to your doctor about those. And for fiber, you might notice it says decreased needs, which can be confusing to people because technically, according to the RDA, older adults do need less fiber than younger adults. So why am I saying that older adults need more fiber? So I think that the RDA being lower for older adults is a little misleading because the truth of the matter is that 95% of adults fail to meet the RDA, which means in general as a population, we are not eating enough fiber. And while technically older adults need less per the recommendations, most of us aren't eating enough. So as a general rule, all of us need more fiber. Fiber is important. It plays a role in healthy digestion, feeling full, preventing constipation, and also decreasing risk of heart disease, diabetes, and some cancers. So it's a very important nutrient. And finally, with B12, older adults don't necessarily require more vitamin B12 than younger adults, but absorption of vitamin B12 does decrease with age. So the RDA, that recommendation of how much B12 you need, is based on 50% absorption in the body. But we know that 10 to 30% of older adults are unable to absorb vitamin B12 through food sources. And so therefore it's recommended that older adults get vitamin B12 through either a supplement or fortified foods, something like a cereal, or, when you read the nutrition label on foods, you'll see all the extra nutrients they pack in, and B12 is often there. So vitamin B12 is important. Too little can cause anemia, fatigue, stomach issues, constipation, unintended weight loss, neurological changes, confusion, and soreness of the mouth and tongue. And if left untreated, it could lead to deficiency. So all of these nutrients are important. These 6 are especially important with healthy aging, but I want to talk about a couple of specific concerns outside of those 6 nutrients. So we talked about those specific nutrients, but what are some other concerns we may have when it comes to nutrition for older adults? We are concerned about malnutrition, unintended weight loss, and muscle loss in older adults. This is really where I want to dive deep in today's topic, because it all comes down to maintaining independence. And we want you to stay independent for as long as possible. Stay at home, do things for yourself, live out your final years with confidence and the quality of life that you deserve. So maintaining independence is so, so important. Let's talk about malnutrition. We often think of malnutrition as a third world country problem, but we see it right here in our own country all the time, especially in aging adults. We know that up to 1 in 2 older adults are at risk for malnutrition, and that malnutrition can host a whole host of health issues, right? It can cause medical complications. It can increase the risk of falls. Again, it could lead to longer hospital stays, even up to twice as long being in the hospital if you're malnourished. Increased readmission to the hospital means you got home, but then you go right back. Loss of independence. This may mean that someone has to permanently move into a higher level of care. And I think worst of all is that malnutrition can increase the risk of death in older adults. And malnutrition really is a big deal. So how do we know if someone is malnourished? Now, I'm going to show you some kind of technical stuff, but I think it paints a good picture of what are we looking at when we're looking at identifying malnutrition in someone. So this information is from a consensus statement through the Academy of Nutrition and Dietetics and the American Society for Parenteral and Enteral Nutrition. And essentially, malnutrition is diagnosed if 2 or more of the following are present. The first one is insufficient energy intake, meaning that you're just not able to eat the calories you need for one reason or another. Weight loss. So this means you're not getting enough calories, you're losing weight. Loss of muscle mass. When you lose weight, especially unintentionally, you're losing muscle mass. Loss of subcutaneous fat. I will say that fat isn't the bad thing we often hear about. We actually need a certain level of fat. It helps protect our organs and can be a good thing. So we don't want to see these, rapid losses of body fat. And then diminished hand grip strength. This is where we use a little tool that you squeeze and it'll tell you how much hand grip strength you have. And a lot of research has shown that decreased hand grip strength is associated with increased risk of malnutrition. So this is what we're looking at when we're identifying malnutrition. If you have 2, that meets the criteria. So let's talk specifically about unintended weight loss. I feel like this slide's a little technical, so I'm gonna explain it and then I'll give you the high level picture. So when we're looking at malnutrition, one of the things we look at is weight loss. And I am pretty obsessed with stopping unintended weight loss. When someone loses weight unintentionally, they are losing muscle. So the definition of unintended weight loss is technically you've lost 5% your body weight in 30 days, 7.5% in 90 days, or 10% in 180 days. But we also have something called insidious weight loss. And this is where you have this gradual unintended weight loss over time, maybe 1 to 2 pounds per month. And when you get yourself weighed, it doesn't seem like that big of a deal. But then when you look at your weight from year to year, you're like, oh man, I've actually lost a lot. So the reason why unintended weight loss is such a big deal is that it ties in with muscle. So talking about sarcopenia. Sarcopenia is defined as a decline in muscle tissue with age. It's the major cause of functional decline and loss of independence in older adults. Sarcopenia actually starts when we're quite young. It could be in the 3rd or 4th decade of life. And once it starts, the loss of muscle mass continues each year. So what's the big deal with muscle loss? I'd say first off, it's not that it's just a little muscle loss. And we'll see over in the next slide how it could really add up over time. But we know that the loss of muscle or sarcopenia can be detrimental in older adults. It increases fall risk. That in turn increases risk of fractures. And we know something like a hip fracture in frail older adults can mean a long, hard road for recovery that could really impact quality of life for a long time. Sarcopenia also impacts our ability to do things independently. Like I mentioned, getting out of bed, getting dressed, brushing teeth, making food. It decreases level of independence and increases likelihood of death and disability. So I want to mention this too, this picture we're looking at. This is a kind of a cut of a leg. And what we're looking at is a 25-year-old versus a 63-year-old. So you could see this is the outside of a leg, the little white spot on the inside is bone. The white around the outer edge is fat, and the kind of gray color is muscle. So you can see with both of these people, the 25-year-old and the 65-year-old, about the same size legs. So if you were looking at both these legs, they look about the same size on the outside. But what we don't see is on the inside, where the 63-year-old has a lot less muscle than the 25-year-old. This is sarcopenia. So let's take another look at sarcopenia. Our percentage of muscle mass typically peaks around age 25. From there, we begin to see that gradual decline in muscle mass. Remember, it usually hits around the third or fourth decade. And we see typically an 8% loss of muscle mass each decade in between ages 40 and 70. So that's a 24% loss of muscle in a 30-year time span. After age 70, it just keeps getting worse. We typically see a 15% loss in muscle mass every decade after 70. So you can see on this graph, the blue shaded area is defined as the total muscle mass of less than 70%. And it's in this zone that we see the highest risk of death. So sarcopenia really is a serious issue, and if left unchecked, it can lead to significant disability and perhaps even earlier death. So I know this is a lot of information I just unpacked, but I just want to summarize that unintended weight loss is a big deal. In our culture, we really celebrate weight loss. Maybe you've experienced this yourself. You're in recovery. You've lost weight unintentionally. You didn't mean to do it. You just lost weight. And someone makes the comment, wow, good job. You lost weight. You didn't even have to try. So our culture tends to glamorize weight loss. But when you're talking about recovery and maintaining your muscle mass, unintended weight loss is a big deal, because with that weight loss comes muscle loss. So the bottom line is that unintended weight loss leads to muscle loss, which leads to decreases in loss of independence, increased fall risk, and risk of early death. So I am really on this mission to spread awareness that we need to stop unintended weight loss in aging adults. So you may be wondering, okay, this is doom and gloom, Ketie. I'm going to lose all my muscle mass. What can I do? There's things you could do. So in order to preserve our muscle, there's two big things we look at. We combat sarcopenia and we protect our muscles with both protein and resistance exercise. So getting enough protein in your diet and doing resistance exercise, which is weights. It could be bands, anything that, causes some resistance on your muscles. So now let's shift gears. We talked a lot about the science of things, and I hope this is going to really provide that good basis as we talk about the nutrition parts. Let's dive deeper into the benefits of maintaining a healthy lifestyle during rehab and post-discharge. So let's talk about during rehab. From a dietitian standpoint, there are two big concerns I have for anyone in rehab. That is healing and preventing muscle loss. So I like to paint this picture of what food is to our bodies compared to what gas is to cars. For a car to go, we need gas, right? We go to the gas station, we fill up, and we're able to drive around until we're on empty. With our bodies, our gasoline is calories. Calories come from food. Food provides us energy. It helps our bodies to work. And when you are healing, whether or not you have an open wound, a broken bone, a serious illness that you're recovering from, your body is working so hard on the inside to heal. So it's using a lot of gas. It's using a lot of calories to provide that healing for you. So we often don't think of how many calories we need just to walk around, just to sit here and breathe, for our heart to beat, for our body to work. But then if you add on that healing during recovery, you're using even more calories, even more nutrition. So my big priority is healing, but then also preventing muscle loss, because remember, the more we could preserve your muscle, the more it's going to help you remain functional and be independent and live the quality of life that you want. So with those two things in mind, my key points and key takeaways for during recovery. Adequate meals and snacks. So we need to make sure that you're getting enough food, you're getting enough calories, you're getting enough fuel to not only fuel your body, but fuel the healing of your body. So if for any reason you find yourself, you can't eat, you have a poor appetite, you're getting full fast, maybe you just don't like the food that's coming because it doesn't taste very delicious to you because you got something going on. For whatever reason, you're not able to eat, talk to staff. This is really important. We need to make sure that you're getting good nutrition in your body. So if there's anything going on, you might need to talk to your healthcare team, talk to a dietitian, and see what can be done to help you get the nutrition you need. So this looks like eating 3 meals a day, snacks in between meals, whatever you can do to get that good nutrition so that way your body can heal. The next piece is adequate protein. You probably keep seeing this theme where I keep talking about muscle, and protein is so important for muscles. So we want to make sure that we're getting an adequate protein source with each meal and snack. Adequate hydration is important too. Most of our bodies are made up of water, so we need to make sure we're getting enough fluid for healing in our bodies and for recovery. And then finally, exercise, but I have in parentheses as able. I recognize when you are in recovery at rehab, for whatever reason you're there, you usually don't feel the best. So I always say exercise as able. Exercise is prescribed by your healthcare team, but this could look like if you have physical therapy coming in to work with you, making sure you're doing those exercises, asking them, what can I be doing to really protect my muscle, especially at a season where you might be more bedbound and you're not using your muscles a lot. So when it comes to nutrition and health during rehab, we want to get you enough nutrition, enough calories, so that way your body can heal. And we want to prevent muscle loss, and that looks like getting enough protein and exercise as you're able to. So let's shift gears to post-discharge. So this is, you are no longer in rehab, you are home, wherever home is for you. So my 2 nutrition concerns to keep you at home, keep you independent. I want to keep you staying healthy. And again, I want to help you maintain that muscle. So the key points here is eating a balanced diet, eating balanced meals, getting adequate protein, adequate hydration, exercise as able, and maintaining weight. You'll notice my recommendations are very similar for, during recovery and after recovery, but really focusing on eating healthy, balanced meals when you're home. When you're in a facility, they are providing good nutrition-based, balanced, healthy meals. But when you're home, it really comes on us to make sure we're getting those good, healthy, balanced meals. And also making sure that we are checking our weight, so that way we don't have that insidious weight loss creeping in where we could be losing muscle without realizing it. So I just wanted to bring the slide up again because we talked about kind of a lot of doom and gloom of muscle loss and all these things, but just remember that your lifestyle and how you live affects how you age. So good nutrition, hydration, physical activity, good sleep habits, mental health, and having a healthy lifestyle, and knowing that it's never too late to make good, healthy changes. So I do want to talk more about nutrition and hydration and dive into some specific nutrients like the protein. But I also want to talk about what a balanced meal looks like, or a balanced plate. I really like My Plate for Older Adults. This was created by Tufts University, and I like it because they make it easy to get all the nutrients you need in. It's not complicated of measure this much of this and this much of this. It's very general information, and because you're eating food from all the food groups, you're getting all of the nutrients that your body needs. So I'll just break this down for you. What we're looking at is all of the main food groups: fruits, vegetables, protein, dairy, grains, healthy fats, and fluids. So they paint a picture of having your plate, having half of your plate be fruits and vegetables. Fruits and vegetables have lots of micronutrients. Those are those good, vitamins and minerals that are good for all the functions in our body. So by having half your plate fruits and vegetables, this means that you're getting lots of good nutrition and fiber. 1/4 of your plate should be grains, preferably whole grains. It has a little extra punch of fiber. And then 1/4 of your plate being protein. So this does include meats, protein that's vegetarian based, and then also dairy. In the middle, we have a little bit of heart healthy fats. And then on the side, of course, getting adequate fluids. And we are going to dive deeper into protein because protein is really important to preserve our muscle. So protein is a nutrient that plays an important role in the health of the older adult. Protein is found in every single cell in our body and is essential for life. Protein supports good health, immunity, maintains muscle, physical function, and all of the things. Now, we know that nearly half of all protein in the body is found in muscle, and muscle mass decreases with age. Remember, we talked about that sarcopenia, that loss of muscle mass. So I think when it comes to protein, the reason it's such an important nutrient is that it really comes down to independence. This is the nutrient that's going to help you to promote independence. So that way you can preserve your muscle, stay at home, stay out of the hospital, and stay healthy. So the question is, how much protein do you need? I mentioned the RDA, that recommended daily or dietary allowance, which is recommended on how much of a nutrient you should have a day. So the RDA for older adults is the same as for younger adults, but emerging research suggests that older adults do need more protein. So our protein needs are based on our weight. They're the same for men and women, but if you're smaller, you probably need a little less, but if you're larger, you need a little more. So the RDA for all adults greater than age 19 is 0.8 grams protein per kilogram body weight. What does that mean? Typically, when we talk in weight, we talk about pounds. We don't talk about kilograms, right? So to break it down, there are 2.2 pounds per kilogram. So if someone weighs 150 pounds, they weigh around 68 kilograms. We would multiply that by 0.8, and that 150-pound person would need about 55 grams of protein is what they would need. So this is for adults in general, but we know that with all those changes in the body that we talked about earlier, that older adults probably need more protein. And there's a lot of research that supports this. So researchers recommend that older adults actually consume anywhere from 1 to 1.2 grams of protein per kilogram body weight versus that 0.1. So using our same 150-pound person, that would mean that instead of the 55 grams of protein, they would need 68 to 82 grams of protein per day. Now, I do really want to emphasize that endurance and resistance training, so working those muscles, is really important to preserve our muscle along with protein. So it's not just protein, it's protein and that resistance exercise. So protein can be a tricky nutrient. I will say the exception to the rule for people who need more protein would be people who have kidney disease. And again, if you do have kidney disease, talk to your doctor, because we know that too much protein can cause damage to your kidneys depending on the overall health and what your labs are saying. So yeah, always talk to your doctor, especially when it comes to protein. So we know it's important to get the right amount of protein. Too little can cause malnutrition. It can cause muscle loss. It can lead to decreased physical function, loss of independence, increased fall risk, hospitalization, and mortality. So we want to make sure that we are getting adequate protein. Let's talk about what foods have protein. Protein is found in a wide variety of foods. Some of the foods highest in protein come from animal sources, but we do know that fruits, vegetables, grains, legumes, and nuts also contain protein. Older adults who consume a vegetarian diet, you just need to make sure that you eat a wide variety of plant-based, high-protein foods throughout the day. So here are some foods high in protein, and you can see the serving size and how much is in it. So beef is pretty high in protein, just 3 ounces provides 24 grams of protein. Greek yogurt, salmon, chicken, cooked lentils, almonds, milk, quinoa, these are all good sources of protein. So in addition to eating high protein sources, the timing and distribution of protein is important. So I'm just going to break this down really quickly for you. Our bodies can only process so much protein at a time. So for someone who needs 60 grams of protein in a day, if you have a really high protein dinner and you get 60 grams of protein, that's actually not going to cut it, because our bodies can't utilize that much protein at one time. So we need to spread out how much protein we eat throughout the day. That's why I talked about getting a good source of protein with breakfast, lunch, dinner, at snacks, so that way your body can adequately absorb that protein. So here's some more examples of high protein foods. I wanted to reiterate that those following a vegetarian diet, make sure you eat a wide variety of high protein foods throughout the day to ensure you're getting all of the all those good healthy proteins your body needs. And I will say that some people just aren't able to get the protein they need through food alone. I'm a dietitian, so I'm always going to recommend food first. But if for whatever reason you're not able to get the protein you need, supplementation may be beneficial. So it's always important to work with your healthcare team to determine if you need protein through supplements versus the ability to get it through diet alone. So how can we optimize our intake of protein? We're going to talk about a few strategies. And this is really focused on when you're at home? How do you make sure you're getting these good protein sources at home when it's really dependent on you to make these meals? So we're just going to talk about what to do when shopping, during meal prep, and at the table. I'll give a couple basic tips on each. So when it comes to purchasing food, make sure that you are purchasing foods that are naturally high in protein, like meat, lentils, eggs, what we talked about in the last slide. But then also remember to read food labels for protein content. If you're buying any boxed or packaged foods, you just read the food label. The things we're going to look at is the protein right here, but also what is the serving size and how many servings are in that container. You might have a container that's just one serving and here's the amount of protein in this product, or you might have a product that has 10 servings that are half a cup each, and then you have to do the math depending on how much you eat. So during meal preparation, I mentioned making sure that you include high protein foods at every meal throughout the day. Breakfast is really a good opportunity for protein. Some people can eat like maybe a piece of toast and coffee and that's their breakfast and skip protein altogether, but this is really a meal that we want to get some good protein in. It could look like having eggs or Greek yogurt. Also include things like meats, beans, and lentils throughout your week. And if you are eating those plant-based sources, spread them throughout your day. Thinking of like, how do I use lentils? You could use lentils and, all kinds of veggies in a soup. You could put them on salad. There's lots of ways to implement these foods in your everyday diet. So at the table, ways to get more protein would include having, high protein beverages, like maybe a glass of milk or a milk alternative at the table. So that way you're drinking a little protein in addition to what you're eating. And then also having high protein foods as snacks in between meals. And snacks could look like cheese, hard-boiled eggs, hummus, etc. So we know that protein plays a vital role in health, muscle strength, and independence in aging adults, and getting adequate protein throughout the day is of significant importance as we age. So we've been talking about a lot of high-level general nutrition information, but I do want to briefly highlight nutrition for the management of specific medical conditions. Now, everyone who's listening, you may have a different medical condition. So just know that managing your current health conditions is really important. We do that through diet. We do that through medications. We do that through other means as recommended by our healthcare team. But know that there are specific nutrition recommendations that can help with your medical conditions, from diabetes to heart health to kidney disease to osteoporosis. So nutrition is really important and plays a role in managing our health conditions. The better we manage those health conditions, that can also help keep us home, keep us out of the hospital. Example of that, if you have diabetes, having high blood sugars, that could increase your likelihood of going to the hospital. So if you're able to manage your diabetes through diet, having a low carbohydrate diet, then you can stay home, be independent, all the things we talked about before. So wrapping things up today, I hope that I took you guys on a fun journey. I hope that you learned a lot. We talked about the changes in nutrition and health with aging. We dove into the science of things. We talked about the physiology of aging, the health changes we see, and the nutrition needs that change. And we also talked about other issues like unintended weight loss, malnutrition, and sarcopenia. We talked about the importance of maintaining a healthy lifestyle and what that looks like related to nutrition during rehab and post-rehab, the importance of getting enough nutrition, enough calories for our body to heal and to stop unintended weight loss. We dove into some specific nutrition information, looking at My Plate for older adults, that general recommendation on how to get a good, healthy, balanced diet, half your plate's fruits and veggies, a quarter protein, a quarter whole grains, getting some heart-healthy fats in there, and drinking adequate fluids. We dove deep into protein because protein is going to help our muscles. And now, as we wrap things up, I hope that you're able to understand some of the changes in nutrition and health with aging, the benefits of maintaining a healthy lifestyle during rehab and post-discharge, and how that can keep you independent at home, out of the hospital, and how you can manage your own health to prevent future complications. So we are doing good on time. We have a whole 10 minutes for questions. So I would love to know what questions you have for me. If you have anything you think of later, my contact information is on the screen. So you can go to my website, thegeriatricdietitian.com, or email me at thegeriatricdietitian@gmail.com. So thank you guys so much for joining me on this journey, and I'm happy to answer any questions you may have.
Thanks so much, Ketie. We didn't see any questions come through in the chat, but I really appreciate you having your contact information available for anyone that might have any questions later. This was a great presentation, and I hope you guys all enjoyed it and got some valuable information on how you guys can maintain a healthy lifestyle after post-acute care and during. It actually looks like we just got a question. We have a question about how much can we indulge in sweets for fun?
Oh, good question. So, when people talk to me as a dietitian, they often think, are you going to put me on a diet? But I think that food is important for many things. If you are getting good, healthy nutrition, you're getting enough protein, you're eating your fruits and veggies, then enjoy your sweets, enjoy your desserts. Now, if you have certain medical conditions that say, okay, less sweets, that's a different conversation. But a lot of the focus I have, especially with aging adults preventing malnutrition, is getting enough calories. For some people, they don't have appetite. They don't feel good. They don't feel like eating. But many people have a sweet tooth, and while maybe they can't eat a meal, they can sip on a nice high calorie shake, and that's going to help prevent weight loss, preserve their muscle mass, keep them independent. So nutrition needs absolutely change as we age, and enjoying your sweets, absolutely, that is something you can do. I would never tell someone don't eat sweets. Enjoy your life, enjoy your sweets. Just make sure it's in balance with all the other things you're doing to take care of your health. Good question.
Perfect. We got a couple others coming through. Barbara asks, how do you feel about intermittent fasting?
So intermittent fasting, there's a lot of really interesting research on it. And I do want to preface what intermittent fasting is for people who aren't sure what that means. And also to say that there's lots of definitions on what that is. Fasting just means you go a certain period of time without eating. All of us fast when we sleep, right? If you think of the time from, the last time you eat before you go to bed to when you wake up, we have breakfast. We are breaking the fast. We go a period without eating. But intermittent fasting is more looking at during the day, having a window of time that you eat. Some people have longer windows. Some people have shorter windows. So in general, there's a lot of research on it, though I don't recommend intermittent fasting for the general public. Some people may have medical conditions that they would benefit from fasting, and that's certainly something you can do. But for the general public, I don't recommend it. But it's one of those things with anything in science, research continues to emerge, and it's something we'll continue to take a look at. And I guess I want to say one high level thing too, because when I'm talking about aging adults, again, anywhere from 65 to 105, that is a huge span of time of age, and everyone has different medical conditions. If someone has diabetes, I don't want to see them going that long without getting nutrition. They need to make sure they're getting some good fuel so that way their blood sugars don't drop. And especially as someone ages and maybe you're at an increased risk for falls, I don't want to see you going too long without getting fuel in the tank, right? So again, it's hard to answer that one without giving that really broad general principle of it depends on your situation. For the general person, I don't recommend it, but it can have benefit. And there's a lot of cool research coming out in that area.
Great. Thanks, Ketie. And then we have one more. How long does it typically take to change someone's nutrition habits? And then especially older adults who might have these habits ingrained for decades.
Change is hard. Right? Change is hard, and it's hard for any of us. And so for me, when I'm working with an older adult, I'm not trying to go in there and changing everything. I really focus on what they want. Like, what are your goals? Are your goals that you want to be independent, stay at home longer, or is your goal you just want to enjoy this food you want to eat? So I really work with the individual person on what their goals are, and I focus on making changes they want to make. So I'm not sure who's asking, if you're asking for yourself or someone that you care about or someone you're taking care of. But I think talking about caregivers, it could be very easy to say, okay, your diet's horrible. Let's make all these changes. But if the person who's eating those foods doesn't have buy-in, they're not going to want to do it. They're going to be frustrated, and change is going to be really hard, if impossible. So really it has to be based on the goals of the individual, what they want to do. And yes, habits are ingrained for decades. And I'm not looking at changing someone's habits. I'm looking at, okay, if this is the way you're eating, what's one thing we could do to make a good change? What's one thing we could do to help your health? And again, from that high level, my concern is protecting your muscle, to keep you independent and to keep you healthy. So for me, that might look like, let's make sure you're getting enough calories. Let's make sure you're getting enough protein. Let's make sure that you're working with your healthcare team so you can get some exercise to protect that muscle mass. So habits are hard to change. And my goal isn't to change people without their buy-in. They've really got to want to make the change. And if they do, change is still hard, even if you want to do that. I think all of us can agree with things we all start, like change is hard. Start with one thing at a time and really focusing in on why am I doing this? I kept talking about muscle mass and independence. So if you're making a change of like, well, I'm going to start weighing myself to make sure I don't start losing weight. And I'm going to start doing some resistance exercise, spreading my protein throughout the day. So that way I maintain my muscle mass, because my goal is I want to stay independent. I want to be able to play with my grandkids. So I think if you tie in a change you want to make with your diet to a goal in your lifestyle, that's going to make it a lot easier to make that change. So hope that helps.
Perfect. Thank you so much, Ketie. Those are all the questions we have for now, but looks like one more might have popped in. Says, can you speak to the research on the effects of refined sugar on the brain, inflammation and brain fog, etc.? I've heard Alzheimer's being referred to as type 3 diabetes. Is it better to choose unrefined and non-artificial sugars and things like higher cacao, dark chocolate if we do eat sweets?
That's a good question. And again, it comes down to, it just depends on your individual goals and what you would like. And we know that there's a lot of benefits to dark chocolate. It's certainly a healthy, good food. So if you don't eat a lot of sweets, but you like dark chocolate, absolutely eat that. But I think when it comes to sugar, it depends on someone's goals, right? So if someone is, maybe they are right out of rehab, they are losing weight unintentionally, they're losing muscle mass. With that muscle loss comes, increased risk of falls, going to the hospital, premature death. For that person, I'm okay with them eating sweets if that's all they could eat, because I want them to get the calories to be able to stop that muscle loss. But if you're talking about someone in the prime of their health, they're healthy, they're really working on what can I do with my nutrition to get the most out of it, and I want to cut back on sweets, then absolutely. So there is a lot of research on sugar. I do think that sugar can be, in small amounts, can be fine in the diet. But I think so often we look at things to take away, but I like to talk about things we could add. So what are some good healthy things we could add that can help decrease inflammation and can help, decrease brain fog if that's something you're experiencing? And that could look like eating a diet high in fruits and vegetables, eating some, nice lean protein sources, eating whole grains. So thinking of what are those healthy foods that you could add on to provide a health benefit for you. So that's really the angle that I look at. It depends on the person, their goals. Dark chocolate's amazing. It's delicious, got great heart health benefits. But when it comes to sweets, I'm supportive of people eating sweets. I'm not the person who's going to say no sweets at all, but I think it's really about what are the healthy things we're eating outside of sweets, because of course, if all we're eating is sweets, that's a problem. But if it's something where maybe a couple times a week, you're just enjoying some cookies or some cake, that's fine too.
Perfect. Thank you so much, Ketie. That wraps up on the questions today in the webinar. Ketie's contact information again is on the screen right here. And if you have any other information or any questions, feel free to reach out to her. You can also reach out if you have any questions about Prestige Care or skilled nursing facilities in general. Feel free to email info@prestigecare.com for any additional information or questions you may have. Thank you guys all so much for attending the webinar today. Ketie, amazing. Thank you so much for hosting our webinar today, and have a great day, and hope you guys all have a wonderful day and got some good insight today.
Thanks for having me.
Thanks, Ketie. Bye-bye.